Hello everyone, you're watching the Voice News Network. My name is Pragya Devan and today I'm joined by Dr. Dilkush Panjwani, who's an assistant professor at the University of Toronto's Department of Psychiatry and consultant psychiatrist at Trillium Health Partners. He's the president of the Indo-Canadian Psychiatric Association. Dr. Panjwani has vigorously promoted dignity for those suffering from mental health issues and workplace injuries and has dedicated his career to helping patients without access to care and advocated to end the social stigma of mental illness. He has also promoted pluralism by connecting diverse community organizations and initiating interfaith and intercultural dialogue. He was appointed to the Order of Ontario in recognition of his outstanding contribution and achievements. Thank you so much, sir, for joining us today.
Thank you, and thank you all the Voice staff for inviting me. As you know, mental health is a very important subject.
Yes.
So thank you for...
It's our pleasure, sir, to have you here. So today we'll talk about the effects of COVID-19 pandemic on mental health. And I know it's a broad topic and there is a lot to discuss and talk about it, but I'll start with the stigma, which is associated with mental health. A lot of people in our society are scared to visit a doctor when it comes to mental health. What do you have to say on that?
Well, when someone appears to be different than us, we may view him or her in a very negative, stereotyped manner. Society feels uncomfortable about mental illness, about talking about mental illness, yet 1 in 5 people in Canada live with a mental illness. So there is stigma about mental health, mental illness, and there is now a stigma about COVID-related stigma. There are stigmas of various sorts. So COVID-related stigma also is affecting a lot of population.
So what are the effects of this stigma?
Well, stigma affects people who are suffering from mental illness, their family members, and the society at large. So first of all, there is rejection and exclusion of the person who is suffering. He develops a fear of the mental illness. There's a loss of self-esteem. The person with mental illness has difficulty making friends. They also sometimes, the person and their family members are hesitant in seeking help for the patient. So they are afraid that the diagnosis of mental illness might affect their career, their prospects of getting married, etc., etc.
And how can we deal with this stigma?
That's a very good question. In the year 2020, humanity was faced with an access of multiple global crises, and that has continued somehow in 2021. First of all, we had COVID-19 pandemic worldwide. We had economic disaster. There's systemic racism in many parts of the world. Climate change is also a very important crisis, and terrorism. So we are facing with multiple crises, and mental health crisis is no exception. A dramatic emotional or circumstantial upheaval in a person's life is predicted, which leads to mental disorders. Now, you may ask, what do we do? Yeah. It is our collective responsibility, including the media's responsibility, which you are doing now, to nurture and invest in mental health initiatives to improve the quality of life of people with mental illness through education, equitable and accessible mental health care. Anywhere, even in remote communities, they should be able to access. The indigenous people need to access mental health care, and to improve their livelihoods in a better way by creating infrastructure and developing a public-private civil society partnership, a triangular partnership where the public is the government and private enterprises like big industries. Bell Canada is one of which has been taking the initiative, and there are many others, and civil society, which are the NGOs and many other things. So a partnership which is effective will help.
So how can you tell that a person is emotionally affected by the pandemic?
Well, that's a good question. We have to look for signs in the person. Now, what are the 5 signs that you can detect? Is there any fear or constant worry about the pandemic? Does the patient manifest any anger or irritability? Is there a problem with sleep, either sleeplessness or too much of sleep? How is the concentration? Is it affected? Is the person indecisive in day-to-day decision making? And is there any increased use of alcohol or substances to cope with the distress? So these are the 5 signs which one needs to look for. And now, how do you deal with this? In summary, if you see on the slide, there are 5 self-care tips. You need to build and keep a new routine. Everything has changed, so your routine has changed too. So build and keep a new routine, keeping your expectations realistic. Sleeping habits should be regular. Go to bed at a particular time, and more importantly, wake up at a particular time. Eat regular healthy foods, physical activity including going for walks and exercises if you can do it. That helps. Avoid excessive use of alcohol and other drugs. Connect with people. It's very important. Even if you're socially isolated, doesn't mean that you cannot connect with people. You can do it on FaceTime and do it on Zoom. Just a simple telephone call to a friend or a relative who you have not contacted for many months. That helps both you and the person you are coming in contact with. And also, most importantly, set boundaries for yourself. Limit your screen time on iPhone, on emails, checking emails, social media, and avoid too much of media consumption. We feel that there is a bombardment of information and it's of information overload all around us. So we have to avoid that from affecting us. So limit your television and screen time to 2 or 3 hours a day.
So before I let you go, I would want to ask my last question. The recovery from mental illness is a slow process and it takes a lot of patience and resilience. How can we achieve this resilience?
Okay, we'll come to that in a minute, but COVID-19 has raised the prevalence of anxiety, depression, post-traumatic stress disorder, and psychological and mental distress among the general population. There is a condition, a term where you use languishing. New York Times has mentioned that people are languishing about the mental illness. Now, living with young children, pre-existing chronic or mental illness, a younger age, female gender, and frequent exposure to pandemic news are all risk factors that are associated with COVID-19 related distress. So it's a distress we are talking about. It doesn't have to be a disorder. Well, resiliency is the mantra in 2021. Now, what is resilience? Resilience is the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant source of stress. This is the definition given by the American Psychological Association. Resilience usually is defined as positive outcome, bouncing back despite adversity. and it is likely the ultimate goal of human maturity and the single most important target of prevention and intervention science. So we have to pay more stress on developing resilience, and that's a very good question you have asked. How does one develop resilience? So resilience, as I said, is the capacity to bounce back. Whatever you have faced, tragedy, trauma, stress, you bounce back again. So what do you do to build your resilience? It's not easy, it's not a miracle. You have to work on it. So building resilience is an important topic. First of all, sociability. You need to build and form healthy relationships. Optimism. View the future and your own self positively. Always do not give up hope. Flexibility. Change is a part of life. So one has to adapt, first accept and then adapt to change. Build on your self-confidence. Fix a goal and move towards the goal. Base decisions on confidence in one's ability. I am going to achieve this goal no matter what. Insightfulness. Develop an insight, understand people and situations, be able to see the other side, listen to people, just not form your own opinion based on your own attitudes, but openness. Perseverance is important, don't give up. Perspective, view crisis as challenges rather than as obstacles. So it's a challenge which you have to take. Self-control, manage your strong feelings and impulses. Internalization of locus of control, rather than depending on so and so, if the circumstances is this, I will be able to control it. No, the control is with yourself. Your anger, your irritability, your feeling of stress is all internalized. So besides focusing on building individual resilience, we also need to build community resilience. The whole community has to be resilient to succeed. So for a community to be resilient, its members must put into practice early and effective actions. We don't wait for the crisis. We are prepared for it. If the residents of a community, the agencies and organizations take meaningful and intentional actions before an event, communities can establish stability after an event. So we have to be prepared of what's coming and work towards it. So that's how we develop individual resilience and community resilience.
That is a very beautiful way of putting it together, sir. I hope that our viewers will definitely benefit from all the information that you have provided today. Thank you so much for giving your valuable time to us.